Hello, viewers, and welcome to another wonderful segment of Focus on Your Health. I am Rose, and today's topic is focusing on the children. And as always, I have a very wonderful guest for you today, Dr. Haley. How are you, Dr. Haley?
I'm well, thank you, Rose. Glad to be here.
Great. Well, how about you give the audience a little bit information about your background and what you do?
Okay, my name is Dr. CarlaNeill Haley. It's a hyphenated last name. I am an internist and a pediatrician. I practice both internal medicine and pediatrics, which means I take care of children and adults. I call it infancy to elderly medicine. My office is in Smyrna, Georgia on South Cobb Drive, and I am really happy to be here with you today.
Thank you for coming, and we're glad to have you.
Thank you.
One of my questions is, because today's topic, although we are focusing on the children, we want to focus on the immunization part of how do we immunize our children. And my first question is that I know a lot of parents are thinking about, should I vaccinate my children?
In the opinion, my personal opinion, and in keeping with the American Academy of Pediatrics, which is the organization that is responsible for child health nationally in this country, immunizations are needed. They're necessary. They serve a benefit. There's a huge benefit to risk ratio. The benefits far outweigh any vaccination risk. We know over the last 50 or so years that diseases that used to cripple people no longer exist. They're in small numbers because of vaccination. So yes, the answer to the question is we should vaccinate.
Okay, so what about the parents who have religious belief that may feel that the vaccination would go against what they personally believe that will be right for their children? Does that mean that they do not get a chance, they wouldn't have the option of going to public school?
No, that's not how the program works. We recommend vaccinations. We tend to try to work with families to help them understand vaccinations. We do respect people's religious and cultural beliefs against vaccinations. Here in Georgia, there is a vaccine registry, and within that registry, you can register your objection to a vaccine, and you can get a religious exemption certification to give to your school. So within the public schools, there's usually not any difficulty there. You may or may not find a private school or a preschool that is reluctant to allow a vaccinated child to come to the school. But as long as there is on file a religious exemption form, the schools would not get in trouble from the state health department with a child who's unvaccinated in their school.
That is great information, because I know a lot of parents doesn't know that piece of information exists if they didn't want to vaccinate their children. So the next question is, what if a parents feel like the vaccination may be causing some hypersensitivity and they would like to give it the scheduled vaccination at a slower rate? Is there an alternate program that they can actually take part in?
Several families that I work with do want to change the vaccine schedule. Their major concern is that giving too many vaccines in one day may cause immune problems or may cause other health risks. It is the belief of the American Academy of Pediatrics and most pediatric physicians at this point in time that that is not the case. However, I think in keeping with people's beliefs and anxieties and trying to work with families, it's important for us to kind of figure out some alternatives. Therefore, there have been some actually written about. There's one out there people may want to look up called Dr. Bob's schedule. Dr. Bob has written an alternative schedule for vaccine administration, and I do allow patients to choose that schedule in my office. Now, there's some people who want to hold all vaccines till the kids are 2, or want to hold vaccines till the kids are a little older. And although I think that one's a little riskier from a public health standpoint of view, I will sometimes work with families in my office on that one. But I tell people who want to just slow down the series and want to come up with feel a little bit more comfortable, a little less anxious, I tell them to look at the Dr. Bob schedule as the alternative.
Is there a special website for Dr. Bob's schedule, or you just Google it?
You can Google it. I mean, he actually has a whole entire book on child health, but you can just Google Dr. Bob's immunization schedule and it'll come up for you.
Okay. And with the alternate scheduling, is it more costly to parents who want to?
This is where it becomes a very difficult process, because in some doctors' offices will not honor that because it's very taxing on their staff. It's extra visits, and the insurance companies may not pay for the extra visits per se. In my office, what we choose to do is I'll tell the families we'll do Dr. Bob's schedule, but the vaccines that are not at the same time of the regular child checkups, which is when vaccines are usually administered, those vaccines, they would have to have a nurse visit and pay a copay. And then we'd file the vaccines themselves with the insurance company, because the insurance company, you know, will pay for the vaccines. It's the extra visits. So they'll have to pay a copay, have a nurse visit, and that may become their responsibility. But the nurse visit's only about $35. So, you know, even if they had a copay that was $25, they'd have to pay an extra $10. And for a lot of families who are very concerned about this issue, that's worth it. That extra $10 or $15 is worth it.
You're right. You're right. Now, is there a link between autism and vaccinating your children?
The current belief of the medical community is that there is not. Okay, there was a study done way back in the 1970s that showed that there was a relationship between autism and vaccines, but that was a poorly conducted study, and no one's ever been able to reproduce that data to this point. I think that in the strictest sense that there was a proximal relationship between the time that autism was diagnosed and the time that the mumps, measles, and rubella vaccine was administered. And I think that created a lot of public anxiety, and we've not been able to dispel that. That being said, autism is a very serious disease, and parents, I can understand their anxiety and worry about that. And because of that, I try to be very sensitive to people's desires to do different things with the mumps, measles, and rubella vaccine. I don't think that there's professionally, I don't think that there's a relationship, but personally as a parent and just understanding people's anxiety, I try to work with people and give them information and give them options in that area.
Okay, that's good to know. Now, we know the flu season is around the corner. So would you recommend to parents out there that they should vaccinate their children with the flu vaccine?
I think that right now in the medical community, we recognize that flu is primarily transmitted in environments where there are large contexts. So that would be healthcare environment, nursing homes, schools, and things of that nature. This year, the H1N1 vaccine is mixed in with the flu shot, so that wouldn't be two vaccines this year. It would just be one vaccine to encompass both diseases. I think that it is a wise decision to immunize your child against the flu. We have seen in years past that the flu has closed down schools, because once it starts passing through a school, so many people get it that they've had to close down schools. It's not super common, but you never know which year it's going to be that. We feel the vaccine is very safe. There are some people that may get some kind of low-grade immune response that causes a little sniffles, a little runny nose, a little sore throat, maybe a little achiness from the vaccine, but the vaccine does not give you the flu. So, but that's part of your body's mounting an immune response, not so much body getting the flu.
Okay. What about, is there any website you would like to recommend to our audience that if they wanted more information about immunization, they can go to?
I think the primary source for all information about children's health needs to be the American Academy of Pediatrics website, and that is www.aap.org. And that website has information about vaccine myths, about vaccine schedules, about all kinds of information that will put people's mind at ease and make them more comfortable with their decisions regarding vaccination. I recognize in our current society that that's a very difficult choice for some families, but I think families need to be well educated when they make their decision.
Well said, well said. Now, Dr. Haley, do you have any final thought for our audience that you would like to share with them?
I think people forget a couple of things about vaccine, and that is you don't understand the magnitude of the diseases associated with vaccines because we don't see these diseases anymore. And we take the health that we have now for granted in the fact that we've eradicated a lot of these diseases. I'm sure that in some of your Caribbean viewers' countries, though, they see more of these diseases, and we've kind of got a little bit more complacent in the Americas and in places where people live that there's less vaccines. Keep in mind that there's still diseases being transmitted on a daily basis, and one of the most important ones we forget about is tetanus. You know, there's a tetanus booster that children need to get in their 11 to 15 age range, and I tell them that it's particularly important for my athletes, because a lot of that is transmitted by injuries and cuts and bruises and things, that the scrapes they get on the field.
Exactly.
And since I do coach soccer and work with several soccer organizations locally, I tell people, make sure your kids get that middle-age tetanus booster, because all of those rug rashes and, you know, and turf burns and everything that we see these days put your children at risk for that disease as well.
Yes, that's very true, very true. Children run around all the time. Well, thank you, Dr. Haley, for taking the time out of your very busy schedule to speak to us. And hopefully you'll be back again to do some more work with CFTV.
Thank you so much for having me, and I'd love to talk to your audience again.
Thank you. Well, you heard it here, audience. You know the children are the future, and we want to make sure we do everything that we can to keep them healthy and growing very wise. So let's go ahead and vaccinate our children and get them what they need to give them a fair chance in this world. So this is Rose. Stay focused and stay healthy.